Due to both mobility and physical activity level for my patient, it says that he's a runner and he wants to get back to training. Based on that, the type of surgery he had, his history of sports, as well as his weight bearing as tolerated status, I've decided to choose crutches today for his assistive device for this case. We learned in our Introduction to Patient Management class that crutches provide both stability and support, especially when performing non-weight bearing activities for somebody in a cast, but it also provides mobility as well, more so than a walker and slightly less so than a cane. It's also chosen for more younger mobile populations, which is why I've chosen this today for my patient. Considering that this patient is under 60 and is very athletic, I believe he would very easily be able to manage using crutches as his assistive device after instruction. And he also would be very willing to comply with the 3-point pattern that I'll be teaching him today. So today we're going to be using crutches for your assistive device that I've chosen. Because of your physical fitness level and your willingness to go back to training for your running, I think that it will be a very good fit for you, and we're just going to be going through how to walk with them today. Does that sound okay?
Yes.
Okay, sounds good. If you have any questions, obviously don't hesitate to ask.
Okay.
Okay, so today what we're going to be doing is we're going to be getting up in a second from the chair, which I'll kind of instruct you how to do really quick with the crutches. And then we're going to be walking this way and walking back, so I'll be moving the chair for you. But first things first, we're going to put it on your right side, since that's your affected side. I'm going to have you place your right hand over here, and then if need be, there is a little bit of a cushion here for you to push up on with your left hand if you feel the need to. But you're going to be getting out of the chair, pushing through with your left, which, perfect, it's underneath your knee very well, and you'll be using your right hand to push off of the chair. Does that make sense?
Yes.
Okay, sounds good. So if you want to try that for me. Okay, perfect. Yep, and then so these go under the armpits and then hands right there. Perfect. So I'll be moving this out of the way really quick. So then yes, we'll just be back here. So the pattern I'm going to be showing you today is called a 3-point pattern. So what we're going to be doing is I'm going to have you bring both crutches forward at the same time that you step with your right, and you can put as much weight as you feel comfortable putting into your left leg. Does that sound okay?
Yes.
Okay. And then what I'll have you do is do kind of swing through patterns. So we're going to have you actually bring your left foot in front of the crutches. Again, as much as you feel comfortable. So if you want to have it and just meet with your right, that's totally up to you. But we'll walk to about here, and then I'll have you walk back. And you can start with whichever leg you feel comfortable with. So you can start with your left and then move with your right, or start with your right and the crutches and then move your left. Does that sound okay?
Yes.
Okay, so if you want to start for me. That's perfect. Okay, how does that feel for you?
Fine.
Okay, and they look obviously like they fit very well, so they're right at your elbow crease, or your wrist crease, and we'll have you walk back. Okay, that's perfect. Okay, so then I'll bring this back over here, and then we'll have you sit back down. So then kind of similar to what we did before, yep, you'll just kind of put them both over to your right. Lovely, good job. Okay. So, do you have any questions, comments, or concerns for me today?
Well, I know it's just one day removed from my surgery, but I was wondering how long you think I might possibly be on the crutches.
Good question. At the moment, I'm not entirely sure, just because we would need to do other tests and measures and things like that. I would need to talk to your primary care provider, your doctor, as well as the surgeon that did your right hip arthroscopy. But usually these type of surgeries, total time frame is about 3 to 6 months. So you'll probably be in physical therapy anywhere from 4 to 8, depending on how quickly we have you going with treatment and interventions and exercises and things like that. Does that sound okay?
Okay, are you saying then that sometime after the 3 to 6 months I can start training immediately, or am I going to have to wait a period of time?
So that's kind of up to you, as well as how far you've obviously progressed with your exercises and treatment, and how much better you're getting. So I understand like you're very willing to get back into running and everything like that, and that you're very willing to do your training. But obviously with the crutches, we need to kind of take it a little slow at first right now, just to see how well it goes for you walking on them. And we need to slowly progress how much weight you put into that right leg, because we obviously don't want you to get re-injured. So we're just going to take some precautions at the beginning and then kind of see how we go from there. So it's very dependent on how things go at home, how exercises are going for you with your home exercise program that we'll prescribe, and things like that, okay?
Okay,